Sonoma County Healthcare Cost Campaign. SEIU is developing a new strategy to control costs. In the past, we fought over who should pay, us or employers, without challenging industry rate increases. We need public employers to take action with us on rates due to excessive profits, prices, and administrative costs. Some of the public employees that have come together in this effort include Sonoma County Courts, City of Santa Rosa, Cotati-Rohnert Park Unified School District, and Santa Rosa Junior College.
The Sonoma County Healthcare Cost Campaign is an effort to change the dynamic at the bargaining table. SEIU and its members are working to bring together public employers, their employees, and healthcare providers to address rising healthcare premiums. You are invited to be a part of this effort because we can have a successful result if we work together as a team. Soaring healthcare costs keep wages flat. In the United States, wages have grown very slowly since 1999 as health insurance costs have soared. As you see by the blue line on this graph, health insurance premiums nationally have increased by 182%, while wages represented by the lighter blue line have increased by only 50%. And the rate of inflation, as seen here in the gray line, has grown by 40%. This is a huge gap overall between the rate of inflation and the inflation rate in health insurance premiums. This trend is unsustainable at this current pace. To illustrate why, let's look at how this same inflation rate might look on another essential commodity.
What would it look like if food prices had grown like healthcare costs? Here's an example of the cost of eggs, milk, and oranges if their prices had grown the same as medical premiums the past few decades. Why is medical inflation 5 times greater than the overall rate of inflation? 2 main reasons. It's a seller's market. Healthcare executives charge whatever they can get away with, knowing we can't do without healthcare, even when it is too expensive. And waste. 30% of spending reflects quality failures, high prices, and fraud.
So what's behind these soaring costs? The area we're proposing to address with this cost campaign is the area identified by the Institute of Medicine as waste. In 2009, they reported that $765 billion of the $2.3 trillion spent on U.S. healthcare was wasted on these following areas: unnecessary services, missed prevention opportunities, and inefficiently delivered services, prices that are just plain too high, and fraud. And finally, $190 billion in excessive administrative costs. Public employers and employees need and are entitled to know what % of our benefit dollars is waste. Let's take a closer look at just one of these categories of waste.
Let's look at excessive administrative costs. Here is a picture of the explosive growth of administrators over physicians. What are all these administrators doing? Marketing and selling, billing and collections, insurance profits, eligibility determination, paperwork imposed on providers by private insurers. This equates to over $1 billion in excess costs in Sonoma County alone, or $2,200 per person.
The U.S. healthcare system does provide excellent care, if you can afford it. But with the amount of waste included in our costs, the U.S. vastly outspends every other advanced nation on Earth per person. As the purple line shows, we spend more than 2.5 times on average per person than the average industrial country. We've been pushing costs onto patients, employers, and employees for decades. And our system as a whole is not seeing outcomes equal to the level of this spending. Our overall healthcare outcomes rank only 5th when compared to these other advanced nations, and our infant mortality rate, in other words, the death rate of newborns born in the U.S., is the highest of these same nations.
What does this look like with one of our providers? In mid-February of this year, Kaiser reported posting $2.7 billion in 2013 profits on $53.1 billion in operating revenue. Kaiser Permanente is sitting on a pile of first quarter profits, up nearly 44% from a year ago at $1.1 billion.
Let's look even more locally. What are the impacts of these trends on SRJC and its employees? Kaiser premiums for SRJC employees increased over 150% since 2002, more than 5 times the inflation rate. Blue Shield and its predecessors have increased over 250% since 2002.
We are paying for our health care. Health costs are pushed onto patients and their families in the form of reductions in plan design, co-pays, and deductibles. Wages are suppressed as a trade-off against increasing employee health care plan contributions. Ultimately, employee contributions are increased, further reducing employee wages. This contract year, for the first time, Kaiser members are paying a share of the premium.
So the bottom line is cost shifting is not cost containment. Without all of us participating, including our employers, there is no incentive for the healthcare and insurance providers to contain costs. They simply shift them onto our employers, who shifts them onto its employees. This keeps us on the defensive in bargaining, lowers our take-home pay, and harms the community and strains family and public budgets.
It's time to take a stand. If not us, who? The past 15 years have seen unsustainable health care cost increases. We cannot continue down this path. At this rate, by 2018, health care premiums will be 1/2 the equivalent of the average worker's pay in the U.S.
It's time to fix the problem. This campaign continues to be presented to leaders and interested parties and continues to grow in its support from a coalition of SRJC management, classified, and faculty. It has been formally endorsed by the SRJC Fringe Benefits Committee, SEIU, and AFA. Here's how you can become involved and be part of the solution. Join the Blue Card campaign by signing the new Labor Management Partnership for Affordable Health Care and return them to your labor representative. These cards will be presented to the SRJC Board of Trustees on December 9th and in January to the County Board of Supervisors. At these meetings, we will ask both boards to support a new labor management partnership to address the lack of transparency and unsustainable increases in our county health care costs. Also, talk to your neighbors, family, and friends about the Sonoma County Health Care Cost Campaign. And lastly, if possible, attend the December 9th Board of Trustees meeting to show your support. Thank you for your support.